This football stretch has helped thousands of babies. But if this is the only thing you're doing, you're probably missing the most important part of treating your baby's right-sided congenital muscular torticollis. Stretching is important, but stretching alone usually isn't enough. Today, I'm going to show you the same three-part approach I've used for more than 25 years to help babies with right-sided torticollis. I call it the BabyMasterPT Torticollis Triangle. The foundation is positioning because your baby spends hours every day feeding, playing, sitting, and looking around the room. The second side is stretching to gently improve your baby's neck mobility. And the third side is active movement because once you've improved your baby's range of motion, we have to teach your baby how to use it during everyday play. Before we begin the exercises, let's make sure you understand exactly what right-sided torticollis looks like in a baby. With right-sided congenital muscular torticollis, the muscles on the right side of your baby's neck is usually tight. This often causes your baby's head to tilt towards the right shoulder while the face and the chin rotate towards the left. Here's the thing about naming the torticollis. The torticollis is named for the tilt. Your baby has right side torticollis, baby's head will tilt to the right, but baby's chin and face will typically rotate in the opposite direction. These movement patterns matter because torticollis is not only about one tight neck muscle. Over time, your baby begins practicing the same position and the same movement pattern hundreds of times throughout the day. That's exactly why stretching alone usually isn't enough. We have to improve the flexibility of the tight muscles, change the position your baby spends time in, and encourage your baby to actively move towards the direction they've been avoiding. If we've never met before, my name is Cherrick Gordon. I'm a pediatric physical therapist. For more than 25 years, I've worked in living rooms of real families, helping real babies overcome real developmental challenges just like this one. Before we do a single stretch, I want to encourage you to change something much more important than the stretches themselves, and that is how your baby spends the rest of their day. Think about it. You might stretch your baby's neck for 2 or 3 minutes, but your baby spends the other 23 hours of the day feeding, playing, sitting, being carried, and just looking around the room. If all of those daily activities continue to encourage your baby's favorite direction, the tight muscle will continue to get reinforced over and over again and continue to get gradually tighter and tighter. And that's why positioning is the foundation of the BabyMasterPT Torticollis Triangle. There are 3 positional changes I teach every single family. Here's the first one. Move the world, not just your baby. One of the easiest changes you can make is to move the interesting things in your baby's environment. Place toys on your baby's non-favorite side. Sit down on your baby's non-favorite side when you're talking, singing, or playing. Every time your baby chooses to turn towards you, you're doing some active therapy without even realizing it. That's only the first. The second one is actually quite easier. If your baby is watching TV, position the high chair so that all the interesting activity is happening on their non-favorite side. Instead of constantly reminding your baby to turn their head, give baby a reason to want to turn their head. My favorite positioning strategy happens during something you're already doing every single day, and that is feeding. Whether you're breastfeeding or bottle feeding, alternate sides whenever possible. Changing the feeding positions encourages your baby to rotate their head in both directions instead of practicing the same movement pattern over and over and over again. These small changes may not seem like much by themselves, but when you repeat them dozens of times every single day, they add up to hundreds of extra opportunities for your baby to practice moving towards the direction that they've been avoiding. That's the power of positioning. Now that we've changed your baby's daily positioning, let's work on improving the flexibility of those tight neck muscles. Stretching is incredibly important, but it works best when it's combined with the positioning strategies we just talked about. Okay, let's go ahead and set this up and get into our stretches. So this first stretch that we're going to talk about is called the football hold, and this one is for a baby with right side torticollis, which means baby's head will be tilted towards his right side. So here's how you set it up. You can sit with your baby on the ground like I am doing. Put your baby facing away from your body. Pass your left hand in between baby's legs and hold baby's right shoulder down. Now you want the side that is tight, which in this case is the right side. You want that right side downwards. So you want baby's right hand downwards towards the ground. And put baby's head in the elbow of your right arm and bring your right arm across the front of baby's chest and hold baby the way I am holding baby right now. The way you do this is you're going to hold down that right shoulder, and what you're going to do is let the gravity do the work and bend baby's neck so that baby's left ear is touching baby's left shoulder, or it should come fairly close to touching baby's left shoulder. And you just go ahead and relax and rotate baby side to side as you're doing this stretch. Now you notice the way the baby is stretching and how far baby is. You can readjust your arm. And what you want to do is go ahead and do this stretch for 30 to 45 seconds. Now, a couple of things I want to point out with this stretch. A couple of common mistakes that people make is they don't hold that right shoulder down enough, and baby tends to hike that shoulder up. And another mistake is to just overstretch. So how do you tell if you're stretching baby too hard? Baby will start to cry. Baby will start to fuss. You'll notice baby's legs kicking and baby start fussing. And I find that rocking baby side to side is a good way to get baby to relax into the stretch. You can see this one. I'm stretching him. If you look at where his ear is, he is stretching pretty far, but he is relaxed. This next stretch is called the side bending lying neck stretch. Position yourself to where you have baby lying with their head close to your body, and you're going to position yourself on baby's left side. You're going to take your left hand, pass it across baby's chest, and hold down baby's right shoulder. Use your right hand to gently cup baby's head and gently tilt baby's head to the left side. And what you're trying to do is move that left ear and position the left ear so that it touches baby's left shoulder while you're holding that right shoulder down with your left hand. My face is close to his body. I'm talking to him. I'm making some silly faces with him. You can see him reacting to the stretch the way he's kicking his legs, but he is tolerating it and he's doing a fairly long stretch. There are a couple of ways to tell if you're not doing the stretch correctly. One, baby will start crying, and two, baby will actually start kicking and fussing and just getting really upset. Now, a lot of times parents ask me how often they should do this stretch. You should do this stretch about 10 to 15 times a day. I know that sounds like a lot, but I would say do it after every diaper change. So if you're changing a lot of diapers with your little one, you can do this stretch. You're already in position. You just did a diaper change. Baby is clean and baby is fresh. And now you can go ahead and do this stretch and mix it up throughout the day. You can do some of the side bending neck stretch, and you can also do some of the football stretch and alternate those. Now you can see he did really well with this stretch, but of course this is a baby that I've been stretching quite a bit, and so he's gotten used to the stretches over time. Now that we've reached what I believe is the most important part of treating right side torticollis. Now stretching gives your baby more available movement. And you want to take advantage of that movement by using active movement. Active movement teaches your baby how to use the available new range. After every stretching session, we want to have a baby or give baby a reason to actively turn towards the direction they've been avoiding. One of my favorite ways to do this is with toys. Instead of placing toys directly in front of your baby, move them just off to their non-favorite side. Now your baby has a reason to turn their head, follow the toy with their eyes, and practice using that new range that you just created with the stretches. Notice what's happening here. Your baby isn't doing an exercise. Your baby is playing. But from a therapy standpoint, they're strengthening muscles, improving coordination, and teaching their brain that turning both directions is completely normal, which is exactly what we want. Every time your baby chooses to look towards their non-favorite side, they're getting another repetition. Those repetitions add up throughout the course of the day. This is why I love combining positioning, stretching, and active movement. Each one makes the other one work even better. When you only stretch, progress is often slower. When you combine all three sides of the BabyMasterPT Torticollis Triangle, you're giving your baby hundreds of opportunities every day to build better movement patterns. And that's exactly what lasting change looks like. Let's go back to the BabyMasterPT Torticollis Triangle one last time. I want you to remember, and this is important, the foundation is positioning. Every time you carry your baby, feed your baby, place a toy, or position in the high chair, you're creating opportunities for better movement throughout the entire day. The second side is stretching. Gentle stretching helps restore the neck mobility your baby needs to be able to move freely. And the third side is active movement. This is where your baby learns to use that new range of motion during play, exploration, and everyday activities. Here's what I want you to remember. No single stretch is going to fix torticollis. No single exercise is going to fix the torticollis. It's the combination of positioning, stretching, and active movement repeated consistently throughout the day that creates lasting change. If you found this video helpful, I'd like to give you a free copy of my birth to 12-month developmental milestone checklist. Download it using the link in the description, print it out, put it on your refrigerator so you always know which milestones are coming up next. And remember, once your baby begins turning their head more freely, the next challenge is learning to use that new movement during tummy time. So click on the next video where I'll show you exactly how to build on the progress you've made today. If this video helped you, consider subscribing because every week I share practical, evidence-informed strategies you can use at home to help your baby reach their developmental milestones with confidence. Until next time, I'm Cherrick Gordon, Pediatric Physical Therapist. And remember, movement builds more than muscles. Movement builds minds. Real babies, real families, real progress. I'll talk to you soon.